Support for this podcast comes from the Central Valley Journalism Collaborative, connecting communities with the resources, infrastructure, and networks to ensure a vibrant local free press.
From KVPR in Fresno, this is Central Valley Daily. It's Wednesday, July 9th. I'm Elizabeth Arkalian. For many families looking to conceive, seeking treatment like IVF can be expensive.
The price can vary widely, but a single cycle can total around $25,000.
And now a plan to have insurance providers cover this treatment has been delayed. That conversation coming up after these headlines. California Attorney General Rob Bonta is criticizing the presence of the U.S. military at an L.A. park earlier this week. A convoy of armored vehicles and white vans pulled up to LA's MacArthur Park, but it's unclear why. Immigration agents walked through the park as a group of people stood by in protest.
To see the military parading through a public park where kids play soccer and kids play and the public goes is not who we are as a nation. We have laws that prevent militarization on American soil.
Bonta says his office is continuing to seek information from the federal government in its ongoing lawsuit over the presence of National Guard troops in L.A. California lawmakers have passed a $321 billion budget for this year after facing a $12 billion deficit. The spending plan draws $13 billion from state reserves, which may look like it fills the state's shortfall, but it's actually more complicated. $7 billion of those reserves were already agreed to as part of a 2-year budget plan passed a year ago, before the LA fires and stock market swings from Trump's tariff policies. Scott Graves is with the California Budget and Policy Center.
The $7 billion rainy day fund withdrawal had nothing to do with closing the gap that the governor identified when he released his May revision.
Analysts say California's deficit is expected to grow in coming years. Lawmakers will likely convene a special session to revisit the budget this fall. Public outrage is growing after a worker in Hanford took his own life while working at a meat processing plant. Juan Carlos Soto died in June during his shift at Central Valley Meat Company. The death caused a series of viral videos on social media to call attention to alleged unsafe working conditions at the meat plant.
Central Valley Meat is trying to keep everybody on the hush and doesn't want nobody that's one of their employees to talk about it. I don't work there no more, so I can speak freely all I want.
The TikTok video by the user J02241 sparked thousands of online comments about treatment and work-related injuries while working at the plant. Officials told the Fresno Bee they offered their condolences to the worker, but declined to comment on the incident. Bakersfield Republican Congressman Vince Fong is pushing for a bill in Congress that would improve transportation infrastructure. Fong wrote in a Fresno Bee opinion piece Tuesday that he plans to introduce a bill that would repair roads and expand highways. Fong says he believes improving transportation in the San Joaquin Valley would strengthen supply chains and the local economy. Fong serves on the House Transportation and Infrastructure Committee. Residents in Fresno County may soon have more access to the San Joaquin River. A company by the name of Fig Garden Investments is planning to develop a riverfront access path for residents. Owners of the property say it'll be open to the general public and would connect to Van Ness Avenue. The move is part of a settlement between the owners of the Fig Garden Golf Course and the state. It declared that much of the golf course was state land. River access to the San Joaquin River has been a contentious issue for residents and elected officials.
You're driving through the neighborhood one day, and there, in your neighbor's driveway, sits a metal mess of spider webs the likes of which you've never seen. It's a KVPR car. Tell your neighbors, your family, and your friends if they've got a car they no longer need, donate it. KVPR can turn that unwanted car into great radio. It's a super easy and totally free process. Visit kvpr.org/cars to learn more.
And now to our main story. A new law, Senate Bill 729, is now requiring large employers in California to offer fertility treatment and testing, including for IVF, or in vitro fertilization. This is an option for many families struggling to conceive, and insurers covering the cost of the expensive procedure is a big deal, including for one family in the Central Valley. Anna Rios has been trying to conceive with her partner for 6 years. When SB 729 was announced, she saw a lifeline. That is until legislators voted to delay insurers' responsibility until January, leaving many families like hers in a lurch. The delay means policyholders will have to wait until their open enrollment period in 2026. But for those looking to plan their families now, time is precious. To better understand what this bill includes and more on why it's being delayed, we spoke with Sarah Kwon. She's a freelance journalist for KFF Health News and starts by explaining just how expensive the IVF process is.
The price can vary widely, but a single cycle can total around $25,000. So as you can imagine, that's a lot of money for a lot of people, especially because for many people, there is little to no insurance coverage for it.
So how impactful would this law be for folks?
I think from everything we heard from advocates and patients, it would be life-changing for many patients. I think it could become the difference between whether people get to expand their families or not.
Do we know how many people would qualify for coverage once Senate Bill 729 is passed or goes into effect?
Yes, there was an estimate done that it would cover 9 million people.
Wow.
I think it's also worth noting, so it's a significant number. It's also worth noting that there are many others, at least I think over 20 million others that are covered by, for example, Medi-Cal, Covered California, and other privately purchased insurance plans, self-insured companies, employers with, 100 or fewer employees that don't fall under the mandate. So yes, it's a significant number that will receive coverage. There are even more people who are actually left out of the mandate.
And the bill would cover IVF, but also certain types of fertility testing and things too, right?
Yes. So I think it's helpful to just explain that, the spectrum of fertility care. It can really range from very, I guess you'd say, uninvasive or less invasive services such as diagnostic testing to hormonal medications that could, say, enhance ovulation to artificial insemination, and then to IVF, which is the most advanced fertility treatment. And as we talked about earlier, is expensive and the most expensive.
Now, you reported that Governor Newsom asked the state legislature to postpone this for a second time. So instead of being implemented this month, the bill has been pushed to start now in January 2026. Why all the delays?
Sure. So I also just want to clarify that it's only one delay. It's his second request for the delay. The first request came when he signed the bill, and he included they call a signing message with it and asked the legislature to consider delaying implementation by 6 months. And the reason he said then was to allow time to reconcile differences between the bill and a broader effort by state regulators to expand the mandate to some of the other groups that were excluded from the original law. And then most recently in May, he made another request. And this time, this was included in the state budget process for this delay. And the state now says that, it needs more time to provide guidance to insurers on specific services that weren't addressed in the law, that are part of, the process of IVF, to ensure adequate and uniform coverage. And so some examples of this include embryo storage and donor eggs and sperm. Just again, some of these services that weren't explicitly addressed in the law that have raised questions among insurers.
Got it. Now, what about on the patient side? What could, waiting an extra 6 months mean for them?
Yeah, so I think it's really important to talk a little bit about this because 6 months may not sound like a long time, especially in the world of policy where changes can take years to get passed and go into effect. But because of the way the bill works, the coverage actually doesn't always start on the date the law goes into effect. So the way that it works is that the coverage starts on during the month that your employer renews their contract with their health plan. And so this doesn't always match the start date of the law. So, for example, if the law had gone into effect in July and your employer has a plan that renews in July, then you would have gotten coverage starting in July. But let's say your employer renews their plan, with a calendar year starting in January. That means you wouldn't have had coverage starting until January. And now, with the current delay, people who would have gotten coverage starting in July because their plans renew this month will now have to wait another year until July, or if their plans renew later in the year, such as September, for example, then they will have to actually wait until next September. So they are looking at waiting for over a year for their coverage to begin.
Now, you interviewed a patient in the Central Valley, actually, who's been waiting for this bill and is now left in a lurch. So tell us more of Anna Rios' story.
Yeah, so Anna Rios lives in the Central Valley, and for 6 years, she and her wife have unsuccessfully tried to expand their family, and they have no insurance coverage for fertility treatments. And Anna also has PCOS, a condition that can impair fertility. And so they had already spent thousands of dollars for several failed attempts with donor sperm and artificial insemination over these 6 years. It put a lot of financial strain on them. They had to, go into their savings for each of these attempts. And then, when they finally started looking into IVF, they were quoted over $30,000 at a local clinic for a single cycle. And that led them to explore doing IVF in Mexico, where it's much cheaper. And then during this process, while they were exploring that option last fall, Anna learned about the law and she was very excited. And she said she jumped onto her health plan's app to ask them whether she could get coverage. They said they didn't know. And then earlier this year, she inquired with her HR department. And they also said, more information would come later and they couldn't specify when. And she mentioned that they talked about Governor Newsom's request for a delay, which first came last September when he signed the bill, in their response to her.
And did Anna confirm if she went to Mexico or not?
Yes, she went to Mexico recently.
For IVF?
Yeah, I think she and her wife essentially lost patience because not only could they not find information on whether they would get coverage and when, they couldn't even get more information on when they could learn more. And I think that uncertainty is layered on top of what has already been a really long, distressing, and arduous journey to even get to this point. As I mentioned, they've been trying for 6 years.
And before I let you go, Sarah, we've been talking about how Anna went to Mexico. Do you know if a lot of other people try that option?
I don't know the exact statistics on it, but during my research for the story, I have learned that there are patients who do this. Specifically, Mexico came up a lot, but there are some other countries where people will travel, and this does happen sometimes to people.
Sarah Kwon, freelance journalist for KFF Health News. Thank you very much.
Thank you.
And that's today's show. If you have a health story idea that you think is worth covering, reach out to the Central Valley Daily team. Email podcast@kvpr.org. Today's episode was produced by Carrie Klein, Jonathan Linden, and KVPR, with support from the Central Valley Journalism Collaborative. I'm Elizabeth Arkalian. Find the latest local news anytime at kvpr.org.
These days, there's so much news, it can be hard to keep up with what it all means for you, your family, and your community. The Consider This podcast from NPR features our award-winning journalism. 6 days a week, we bring you a deep dive on a news story and provide the context and analysis that helps you make sense of the news. We get behind the headlines. We get to the truth. Listen to the Consider This podcast from NPR.